So the recovery process for the ACL repair and the ACL reconstruction can often be a little bit different. With an ACL repair, because you are preserving that native tissue, the recovery process can often be shortened by several months. So one is typically looking at around a 6-month recovery process with appropriate rehabilitation for an ACL repair. An ACL reconstruction is often looking closer to 9 months or more for adequate recovery before return to sport.
After ACL surgery, whether it's repair or reconstruction, we do expect some inflammation in the knee, which can be seen as swelling or bruising. Depending on the procedure that you had performed, you may have a variety of small scars. With a repair, for example, you'll have a couple poke holes around the knee, which is necessary for the arthroscopic portion of the procedure, and one small incision, which is necessary for the drilling. If you have an ACL reconstruction, you'll have the exact same scars, plus another small scar for the harvest of your ACL tissue.
Pain is, of course, something that we want to avoid after surgery for every patient. I think it would be unfair to say that surgery comes with no pain. But of course, as we get better with our techniques, we're learning that we can really change the curve.
With repair, for example, many patients feel as though they just had an arthroscopic debridement, a simple knee scope, so to speak. With minimally invasive all-inside reconstruction, the pain's a bit more than, say, for example, compared to ACL repair, but still very manageable.
A physical therapy after ACL surgery is typically a 6 to 9 month process.
It doesn't necessarily mean you need to go 3 times a week, but you need to be have someone captaining the ship to say you can do A, B, and C. I think it's important to have someone that's going to see you weekly, because your surgeon usually sees you at 6 weeks, at 3 months, at 6 months, not daily or weekly.
These days, returning to work or school after ACL repair or reconstruction is quite favorable. Patients are usually on crutches a few days until quadricep strength recovers. Of course, that might happen a little sooner the less invasive we are. As soon as pain is under control and you're mobile, patients get back to their lives, at least for day-to-day life like work and school. For my patients, that's usually been within a week, if not sooner. And I think as we continue to get better, that's going to continue to improve as well.
Recovery after ACL surgery, including the time it takes to get back to cutting and pivoting sports, is the most common question I get asked. When we think about recovery, be it ACL reconstruction or ACL repair, our timeline to get back to return to cutting and pivoting athletics is typically around 9 months. Now that's variable, and we really customize the treatment to the patient, and we'll try to hit certain milestones along the way, and we'll see how you, as you recover from your surgery, can get back to the sport that you love.